Hello, I'm Vic Senese, and this is UroNurse News. Be sure to like and subscribe. Today we're taking a closer look at an important and increasingly debated question in prostate cancer care. Is active surveillance the right approach for elderly patients, or are we unintentionally causing more harm than good? Active surveillance, often called AS, is designed to delay or even avoid aggressive treatments for prostate cancer. The goal? Maintain quality of life while still keeping a close eye on the disease. For men with low risk or even favorable intermediate risk prostate cancer, the data is strong. Cancer-specific survival remains extremely high, and patients avoid the side effects of surgery or radiation. But here's where things get complicated. What happens when we apply this strategy to men aged 75 and older? A recent nationwide study from Japan examined this exact question. The findings? Metastasis-free survival and prostate cancer-specific survival were reassuring. But that's only part of the story. In older patients, something critical changes. It's not just about the cancer anymore. Overall survival is driven more by other health conditions, heart disease, frailty, and comorbidities than the prostate cancer itself. Even major trials like the PROTECT study shows that prostate cancer deaths remain low regardless of the treatment choice. So the question becomes, are we monitoring disease that may never actually impact the patient's life? Active surveillance isn't passive either. It involves repeated PSA tests, MRIs, and often prostate biopsies. And in elderly patients, that can mean increased healthcare costs, physical burden, and psychological stress. In fact, many older men eventually transition to active treatment, even without clear evidence that their cancer has progressed. Sometimes it's difficult to tell somebody they have cancer, but we're just going to watch things. Data from the PRIUS, Japan's registry, highlighted a concerning trend. Persistence on active surveillance in men over 75 was low. Many patients opted for treatment, not because they had to, but because of anxiety or uncertainty. And here's the key issue. Treatment-related side effects increase with age, while survival benefits become minimal. Experts suggest we may need a shift in strategy. For many elderly patients with low-risk disease, a more appropriate approach may be less intensive monitoring, fewer invasive procedures, and a focus on comfort and quality of life. In fact, transitioning from active surveillance to watchful waiting should be viewed as success, not a failure. But let's zoom out further. The issue may not be surveillance itself. It may be overdiagnosis in older men. PSA testing patterns show something striking. Lower testing rates in men in their 50s and much higher rates in men over their 70s, which means we're often diagnosing cancers in patients least likely to benefit from the treatment. So, is active surveillance the right strategy for elderly patients? Well, the answer is it depends. For a small group of very healthy older men, it may still be appropriate. But for many others, it may lead to unnecessary monitoring, anxiety, and even overtreatment without improving survival. As always, the key is personalized care, balancing life expectancy, health status, and patient preferences. I'm Vic Senese. This is UroNurse News, bringing you the latest insights in urologic care. Hey, tomorrow we take a closer look at high-stakes imaging dilemma in urologic diagnostic. When a testicular lesion is indeterminate, do we turn to contrast-enhanced ultrasonography or move straight to MRI? I'm going to break down a new systematic review and meta-analysis comparing these two powerful imaging tools, examining diagnostic accuracy, real-world clinical utility, and how each approach may influence decision-making in avoiding unnecessary surgery while maintaining diagnostic confidence. Is CEUS ready to challenge MRI as a frontline problem solver in selected cases, or does MRI still hold the upper hand when clarity matters most? Hey, you're going to have to join me tomorrow to find out.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines. UroNurse News.